With a vaccine now well on the way, there are increasing concerns that misinformation circulating online could turn some people against being vaccinated. The World Health Organization says the world's not only fighting the pandemic, but also an infodemic, where false information about vaccines and COVID in general continues to spread widely, particularly online. The BBC's global health correspondent, Tulip Mazumdar, reports.
Ever since this pandemic started, we have all been faced with a barrage of information about COVID-19. It can lead to confusion, distrust, and in some cases protests against proven public health advice. Now, with vaccines well on the way, there's a fresh push to separate fact from fiction. I spoke to trainee solicitor Oscar, who's taking part in vaccine trials at Imperial College London, and production designer Nina, who lives with her 82-year-old grandmother, about new COVID vaccines.
Making sense of all of the different scientific opinion and the results that are recently coming out is incredibly difficult.
I think it's quite convoluted at the moment. I think there are quite a lot of opinions flying around over Twitter, over Instagram, TikTok.
I would like to be vaccinated because I think it's one of the only ways out of this situation.
I have quite mixed feelings. I'm not sure how much I trust the vaccine yet because it's happened so quickly.
We feel that many people actually currently they are making a decision not based on the good information, but based on some information they have seen on social media or elsewhere, and they believe it because they have not had access to the right information at the right format.
So the WHO, along with governments, have teamed up with big social media companies to come up with better ways of getting accurate information to people, like this WhatsApp feed, which anyone can sign up to. Facebook has introduced notification screens flagging false information before people choose to share it, but it can still be shared. A number of studies looking at people's attitudes towards a COVID-19 vaccine are underway. Preliminary data from 17 countries suggest that people in Ethiopia, India and Saudi Arabia feel the most confident about taking one, with at least 85% saying they would be immunized. There was more skepticism in countries including Germany, France, the US and also in the DRC, where fewer than 50% of people said they would take a vaccine.
The sciencey ones have more of a negative impact than the ones that are questioning motives of people.
Professor Heidi Larson has been studying people's attitudes to vaccines for more than 2 decades.
What we need to focus on is building the resilience and filling that space. You can't just take away pieces of misinformation. One of the big anxieties is safety. So we can talk about the fact that safety process are being followed carefully. We're shortcutting other parts of that long development process.
Yep. Nope.
Scientists are taking to social media themselves to try and get accurate information out there. The battle against COVID can't be won in hospitals and science labs alone. Part of this fight needs to happen online. Tulip Mazumdar, BBC News.